anterior junction line. It is formed by opposition of visceral and parietal pleura of anteromedial aspect of lung. Small amount of fat is normally present. Here is the diagram. See how anterior junction line appears on chest X-ray. It appears as an oblique line. It crosses the superior two-thirds of the upper surface of the lung. Here you can see on chest X-ray where you can see the double arrow mark is showing the sign. On CT, there is a contact between lung and the retromandibular mediastinal fat. On the arrow mark in the CT diagram, we can see the pathology in the anterior junction line. How it will appear? Either obliteration or abnormal convexity. Here in the diagram we can see double arrow mark and a comparative image of the normal, where you can see if it has abnormal convexity, then it is a pathology which will indicate lymph node, neoplasm, thyroid or thymic mass. Let's see the posterior junction line. What is it? It is formed by the opposition of visceral and parietal pleura of posteromedial aspect of the lung. Here in the diagram we can see it will be seen on chest X-ray. It is seen above the clavicle. Remember, anterior junction line was below the clavicle. In the diagram also double arrow mark is showing the posterior junction line. It will be either straight line or mild convex. On your left there is a diagram which is showing anterior junction line which is below the clavicle, while posterior junction line is above the clavicle. Same oblique line or a straight posterior junction line. How it is seen on the CT? It is seen anterior to T1 and T2 vertebra. On the CT it is near the vertebra, therefore it is a posterior junction line. And on the right there is a comparison of CT of the anterior junction line. It will appear abnormally. It would appear as a bulge or a convexity. This would be abnormal. In the image we can see, and on the right side there is a normal image which is showing how it is a straight line, whereas abnormally there is a convexity. Next is the right paratracheal stripe. It is the parietal and the visceral pleura of the right upper lobe which comes in contact with the right lateral border of the trachea. Here in the diagram we can see. Now how will the right paratracheal and stripe will appear? From the right clavicle to the right tracheobronchial angle, which we can see on the X-ray, the arrow mark. Now how abnormal you have to suspect? Paratracheal lymph node, paratracheal neoplasm, thyroid neoplasm or tracheal neoplasm. And same with everything, there would be abnormal convexity. So in the CT which you can see, this is the right paratracheal stripe. It can be confused with the posterior junction line. On the left there is a posterior junction line. So you can see the difference here. So the right paratracheal stripe is in contact with the trachea on the right side and it is straight. If any abnormal convexity, then let's see the abnormal pathology. Here you can see there is an abnormal convexity of the right paratracheal stripe in both CT and in the X-ray, whereas normal you can see on your right it is a straight line. Therefore, any abnormal convexity, they should consider this. The same goes with the left paratracheal stripe also towards the left side of the trachea, where we can see an image and chest X-ray, and abnormal any convexity on this side would suspect pathology. Next is the aortopulmonary stripe, where we can see in the diagram also formed by the anterior left lung reflecting over the left pulmonary artery and aorta. This will be seen on X-ray. It is seen as crossing of aortic arch and the main pulmonary artery, which we can see by the arrow mark in both CT scan and X-ray. Abnormal aortopulmonary stripe is seen. Seen condition pneumomediastinum, thyroid or thymic mass. Same if abnormal convexity is present, then it suggests this pathology. On the left, we have a normal image of aortopulmonary stripe, and on the right there is abnormal convexity. This is aortopulmonary window. It is different from the aortopulmonary stripe. This window lies behind the aortopulmonary stripe. What are the boundaries? Superiorly, it is the inferior wall of the aortic arch. Inferiorly, it is the superior wall of the left pulmonary artery. Posterior wall is the anterior wall of the descending aorta. Anterior wall is the posterior wall of the ascending aorta. Medial wall is trachea and esophagus. Lateral wall is left lung and the pleura in contact with aortic arch. See the diagram. We have labeled aortic ascending aorta, descending aorta, pulmonary artery, and the star mark is the aortopulmonary window. Now again let us revise. The anterior wall is the posterior wall of the ascending aorta, therefore star mark anteriorly is the ascending aorta. The posterior wall is by the anterior wall of the descending aorta. Medially is the trachea. Lateral is the left pleura and lung in contact with the aortic arch. And this is aortopulmonary window between the aortic arch and the pulmonary artery. Therefore, superiorly would be aortic arch and inferiorly would be the left pulmonary artery. The contents of this epindow: left vagus nerve, left recurrent laryngeal nerve, ligamentum arteriosus, lymph node, fat, and the left bronchial artery. See the abnormal pathology. If abnormal convexity of the aortopulmonary stripe, we have to think pathology. Here on the right side is the normal, we have to compare it with. See, there is abnormal convexity shown by the arrow mark, and abnormality has to be suspected. Let us differentiate between aortopulmonary window and aortopulmonary stripe on chest X-ray. It is very difficult to differentiate between these two. Aortopulmonary stripe and window is clearly differentiated on the CT. On the left you can see the double arrow mark is showing the aortopulmonary stripe, which is a line which we can see, but the window is that the cross mark, the star mark which you can see, that is the window between the aortic arch and the pulmonary artery, and in front is the ascending aorta and behind is the descending aorta. Boundaries which we have seen. See about right and the left paraspinal line. First we'll see about right paraspinal line, where it is formed by the right lung and pleura in contact with the posterior mediastinal soft tissue. It extends from T8 to T12 vertebra, where you can see abnormality, where there is posterior mediastinal abnormality, extramedullary hematopoiesis, or there is osteophytes. It is associated with mat band phenomena. The left paraspinal line, how it is formed? It is formed by left lung and pleura in contact with posterior mediastinal soft tissue. Where it extends from? It extends from aortic arch knuckle to diaphragm. It lies medially to the lateral wall of the descending thoracic aorta, where you can see abnormality, same condition, and it is also associated with mat band phenomena. Let's see how it will be seen. On CT scan, you can see near the vertebra, two arrows are pointed. These are right and the left paraspinal line. On X-ray, you can see this is the right paraspinal line, and on the left you can see it is the left paraspinal line. Note the arrow mark. The left paraspinal line lies medial to the descending thoracic aortic line. See how abnormal it will be seen. Again, abnormal will appear as a convexity. Here you have a diagram of normal also comparing to it, where the paraspinal line was straight, but here a little bulge is seen. We can see the left paraspinal line. Any abnormal bulge or convexity will suggest abnormality, and on the right you can see the normal, where we can compare how abnormal bulge is seen. Revise once again. This is the normal, the right paraspinal line normal and abnormal convexity, the left paraspinal line normal and the abnormal the convexity. And we will study about the zygoesophageal recess. Now what is it? It is a space lateral or posterior to esophagus and anterior to spine, extends from turn of azygous vein to aortic arteries inferiorly. The diagrams are below. See where we will find the azygous veins so as to understand the zygoesophageal recess. Here you can see the azygous vein and hemiazygous vein. Now you will understand the zygoesophageal recess, which you can see on the diagram. On the abnormal pathology of the zygoesophageal reflex, it indicates lymph nodes, hiatus hernia, esophageal neoplasm, the bronchopulmonary abnormalities, and the cardiomegaly with left atrial enlargement. Again, if abnormal, then convexity is seen, and on your left there is a comparison of the normal, and on your right the arrow mark is showing how abnormal convexity will indicate pathology. Revise. Here in the image you can see all the lines, stripes and windows. The posterior junction line is in the yellow. It is above the anterior junction line, above the clavicle. The anterior junction line, the right and the left paratracheal stripe, and the right and the left paraspinal line. Again, another is the zygoesophageal recess, the aortopulmonary stripe and the aortopulmonary window.